myself such time as I may consume.
Gentleman's recognized.
Millions of Americans are finding the security and the peace of mind that comes from having access to a family physician through the Affordable Care Act. And if the gentleman has been listening to the American people, he's turned a 10 ear to the 16 million Americans that have now enrolled in the marketplaces under the Affordable Care Act. Republicans unwilling to accept the success of what they demeaned as Obamacare, Republicans who failed more than 60 times in this House to repeal Obamacare, who failed 3 times in the Supreme Court to undermine Obamacare, have now embarked on a new strategy, which is to circumvent and undermine the invaluable protections of the Affordable Care Act. With this bill, Republicans are demanding that every individual who gets stuck in one of these newfangled plans that they have is denied protection from having their insurer exclude pre-existing conditions, no assurance of coverage for essential medical care, and no assurance of affordability. I offered an amendment to correct one part of this defective bill to give Americans statutory protection so they're not back in the old pre-Affordable Care Act period of losing coverage when they needed it most because they had something the insurance company defined as a pre-existing condition. But that was rejected. At the time, they claimed that was their intent. But when you look at the specific statutory language, there is no doubt that the protection for pre-existing conditions and essential conditions is excluded from their legislation. These so-called individual coverage health reimbursement arrangements, or ICRAs, are about as convoluted as the name suggests. They are, as my grandson's Canyon would say, they're icky. Handing people a voucher and telling them to go shop for coverage follows the same ill-conceived Republican approach to sabotage Medicare, which they continue to promote in their latest budget. Instead of giving Medicare beneficiaries guaranteed coverage, they would give seniors a voucher with declining value and tell them to go find coverage. Instead of the guaranteed comprehensive coverage workers now receive, this bill would force so many people to find health care in a sea of junk, exposing them to misleading marketing and aggressive brokers. An estimated 2 million workers would be immediately impacted by this sorry bill, and with another provision that is in the bill that directs the Treasury Department to go out and promote access to junk plans, we could expect these numbers of impacted workers to increase. Inevitably, the result is bare bones junk insurance that misleads on coverage, has high out-of-pocket costs, and abandons those with pre-existing conditions. The policy's fine print takes away all the bold promises of the marketing. Those who need coverage the most will be unable to afford it or receive minimal junk coverage. In a nation that is rich as America, going broke shouldn't be a side effect of trying to get health care. But exposing more people to financial ruin is exactly what this kind of legislative approach will achieve. This misguided scheme suffers, I think, from a form of pre-existing condition itself. It's called amnesia, because they forget the conditions that existed for so many Americans in this country before the Affordable Care Act became law. Situations like those who contacted me from Texas, someone who had been a victim of domestic violence, declared to have a pre-existing condition. An infant born with some pre-existing condition denied the coverage that they need. Any number of excuses when coverage was needed the most because of pre-existing conditions. That's why I thought it was so important to amend this legislation, and the refusal of my Republican colleagues to clarify that now sends forward loud and clear that that is their objective. There's even more ick to the ICRA bill that is being introduced, and that's the opportunity that is created for class discrimination. This bill legalizes that discrimination. My amendment would have prevented that also. Employees that are out there on the assembly line, those who are in the chicken processing plant or the meat packer or out in the cornfields, they're in the dirtiest, most difficult, and usually the lowest paid jobs. They can be treated one way under this bill, while the executives sitting off in the office tower are treated another and getting an entirely different kind of coverage because of the way they have written their bill. Low-wage workers would who would be eligible, in fact, for a better policy under the Affordable Care Act, a no premium or low premium policy, would instead be required to search for a policy with more holes than safety net. Finally, we discover something on which Republicans are pro-choice. I didn't think they were pro-choice on anything, but the genuine choice that they provide is to the employer, not to the employee, a choice to divide employees into the haves and the have-nots, providing employer coverage to some and leaving others to fend for themselves. Predictably, that burden will fall on the low-wage workers and the sick employees that employers don't want to cover. One survey already of employers found that 60% of large firms intended to offer ICHRA to only low-wage workers. That is icky. To prohibit discrimination by employers and junk plans alike, the amendment I offered would have offered protection. This bill, as it stands, it does not. It should be rejected, and I reserve the balance of my time.
Gentleman reserve.